Hello everyone. Today we'll discuss about anti-malarial drugs. So these are the drugs basically used in prophylaxis, treatment and prevention of the malaria. Okay, used in prophylaxis and as well as prevention of relapse. Okay, prevention of relapse in case of malaria. Okay, so let us discuss about malaria disease. Okay, so malaria is a protozoal disease. It is a protozoal disease caused by plasmodium species. So this may be plasmodium falciparum, plasmodium vivax, plasmodium ovale. Okay, such types of plasmodium species can infect humans. Okay, so basically this malaria basically takes place in two hosts. One host is human. Okay, another host is mosquito. Okay, that is female Anopheles mosquito. Female Anopheles mosquito. So let us discuss the life cycle of malaria. Okay, so malaria occurs when a infected mosquito bites human during its blood bill. It injects the sporozoid into the human. After the injection of these sporozoids to the human. So when this sporozoids enters to human, it enters to the liver and started of exoerythrocytic cell. So then during this exoerythrocytic cell, it infect the liver and formation of sky joint and rupture of the sky joint and release of the release of merozoids takes place. Okay, here when this sky joint rupture, merozoids will release. Then after release of merozoid, this enters to the human blood stage and this will takes place in the human RBC. That's why it is called as erythrocytic cell. So in RBC, these merozoids are divided, converted to trophozoid, mature trophozoid, and this and break and release of this trophozoid, and this release of this trophozoid basically causes clinical symptoms. The release of these trophozoids produce clinical symptoms like fever, chills. Such type of symptoms are seen. Some of the trophozoids are converted to gametes, like you can see that in case of Plasmodium falciparum, both female and male gametes are produced, whereas in case of Plasmodium vivax, ovale, malassei, only only female gametes are produced. Okay, again these gametes again taken up when the mosquito takes a blood from this. Now this human is converted to infected person. When mosquito takes the blood from this infected person, these gametes enter to the mosquito. Okay, then these gametes reach to the salivary gland of the mosquito, and where it get fertilized and again converted to active form of sporozoid. Again when this infected mosquito bites another human, it will give these sporozoids, and their sporozoids have the potency to causes malaria. Okay, so basically the anti-malarial drugs are given to treat the malaria. So basically, what are the conditions what are the objectives of the anti-malarial drug? So if we're talking about the objectives, anti-malarial drugs having four objectives. Okay, one is prophylactic, Second one is curative, clinical curative. Okay. Third one is radical curative. Fourth one is gametocidal. Okay. Antimalarial drug having four objectives. Prophylactic means to prevent the clinical attack. Clinical curative to treat the clinical symptoms. Radical curative to completely eradicate the parasite from the patient. Completely eradicate the parasite from the patient. And gametocidal means to kill these gametes. Okay. So antimalarial therapy given in three forms. This antimalarial therapy can given in three forms. जैसे मैंने आपको फर्स्ट बताया कॉजल प्रोफाइलैक्सिस. Causal prophylaxis means to treat the pre-erythrocytic phase. Okay, to pre-erythrocytic phase that is which occurs in liver. Okay, ये बेसिकली क्या कौन सी कंडीशन को इनहिबिट करता है? इट इनहिबिट और ट्रीट द प्री एरिथ्रोसाइटिक स्टेज. Pre-erythrocytic stage that takes place in our liver, and due to this pre-erythrocytic stage the malarial infection and clinical attacks takes place. So okay, so what are the drugs will be used? I will tell you later. Okay, causal prophylaxis. Second one is suppressive prophylaxis. Second one is what are the drugs? I will in this class I will discuss with you later. Suppressive prophylaxis. Okay, third one is clinical cure. Clinical cure. So these are the conditions, or these are the way where we can give clinical cure. Means these drugs act on the erythrocytic stage. Erythrocytic stage that is takes place in the RBC. Okay, and this care oppressive care act on the schizontocites, or we also called it as a schizontocidals. Okay, now we'll discuss about the classification of the drug. So coming to the classification, so basically we have different class of drug. So let us discuss one by one. First class is 4-aminoquinoline. 4-aminoquinoline, and drugs comes under this class is cap. Cap means chloroquine, CQ for chloroquine, AQ for amidoquine, and piperaquine. Next one is 8-aminoquinoline. 8-aminoquinoline, in the 8-aminoquinoline drug is primaquine. This is piperaquine. This one is primaquine. Then we know that cinchona alkaloids are used. So cinchona alkaloids class. Since cinchona alkaloid drugs are quinine. Then quinoline methanol alkaloid. Quinoline methanol. Drug is Mefloquine. Okay. Fifth one is diaminopyrimidine. डाई अमीनो पायरिमिडिन में ड्रग कौन सा है? पायरिमिथामाइन। ओके, सिक्स्थ वन इज सल्फोनामाइड्स। सल्फोनामाइड्स क्लास ऑफ ड्रग का डेरिवेटिव में कौन सा ड्रग रहता है? सल्फोडॉक्सिम, डैप्सोन, देन सल्फामिथोपायराजाइन। Okay, then seventh one is biguanides. Drug is proguanil. Okay, then what are the antibiotics are used? Antibiotics that can used is tetracycline. Okay, then doxycycline, then we can use also clindamycin. Okay, then sesquiterpene lactone, drug like artemether. Okay, then drug like amino alcohols. This is a broad class. Amino alcohol like haloperidine, haloperidine, lumefantrine. Then next important class is naphthapyridine, and the drug is pyronaridine. And last one is naphthaquinone derivative, and drug is atovaquinone. Okay, we have discussed a broad class of antimalarial drug, that is first one is 4-aminoquinoline. 4-aminoquinoline में drug is chloroquine, amidaquine and primaquine. Then 8-aminoquinoline is piperaquine. 8-aminoquinoline is primaquine. Then cinchona alkaloid is quinine. Quinoline methanol is mefloquine. Then diaminopyrimidine class का drug is pyrimethamine. Sulfonamide derivative sulfodoxime, dapsone and sulfamethoxypyrazine. Biguanide derivative is proguanil. Do not confuse with the biguanides metformin class of drug in anti-diabetic. Then antibiotics like tetracyclines, doxycyclines, clindamycins, then sesquiterpene lactones like artemether, amino alcohol like haloperidine and lumefantrine, naphthapyridine derivative like pyronaridine and naphthaquinone derivatives like atovaquinone. Let us discuss one by one. The first drug is chloroquine. Okay, so first important drug is chloroquine. So chloroquine, one of the important anti-malarial drug used. Okay, it is a rapid acting erythroscytic erythrocytic schizentocidal. It is a rapidly acting erythrocytic schizentocidal drug. Okay, so its mechanism of action is very much important. What it is basically do is it increase its concentration in infected RBC. पहले ये क्या करेगा, इन्फेक्टेड आरबीसी में जाके आरबीसी में अपना कंसंट्रेशन को इंक्रीज करेगा. ओके, देन व्हाट इट विल डू इज it causes polymerization of hem. Okay, that leads to formation of chloroquine hem complex. This hem complex is toxic to the parasite. Okay, toxic to the parasite. So basically what happened, in parasite the hem converted into hemazoin, and hemazoin is a non-toxic metabolite that is that doesn't happen, that does not cause any harm to the uh, uh, this plasmodium species. But when chloroquine is administered, chloroquine basically causes polymerization with hem, formed a chloroquine hemoglobin complex, and this complex causes toxic to this parasite. Okay, so chloroquine is high resistance. Chloroquine resistance among the plasmodium. Chloroquine is resistance against Plasmodium falciparum. Okay, it is nowadays it is highly resistance against Plasmodium falciparum throughout our India. Okay, so chloroquine resistance is rapidly growing throughout our India. Okay, so chloroquine, other than the anti-malarial action, chloroquine having other actions. Okay, what are the other action does chloroquine have? Chloroquine have, if chloroquine is active against Entamoeba histolytica, chloroquine is effective also, chloroquine is also effective against Entamoeba histolytica, also effective in Giardia lamblia, also effective in Giardia lamblia, having also having anti-inflammatory property. That's why it is also used in rheumatoid arthritis, can be used in rheumatoid arthritis. Okay, it is also having smooth muscle relaxant property. Smooth muscle relaxant action. Okay, if we'll talk pharmacokinetic, it is having highest volume of distribution. Chloroquine having the highest volume of distribution. It is nearly equal to aerosol liter, 1300 liter. Okay, so it is 50% plasma protein bound. Okay, so it is basically bounds to the selective tissue like retina. Okay, that's why it causes retinopathy. So one of the associated side effect associated with chloroquine is retinopathy or retinal damage. It can causes to retinal damage due to the accumulation of chloroquine in the retina. Okay, so other associated adverse effect associated with this drug is uh, like epigastric pain, nausea and vomiting. Okay, this retinopathy can also can lead to loss. Okay, vision loss is also seen during this. Then it can also causes ototoxicity, that is loss of hearing. Okay, it can damage the ear, can causes hearing loss. Okay, it can allergy, light sensitive allergy, or we call it as a photo allergy. Okay, it can also causes myopathy. It also causes graying of hair. Okay, if we'll talking to about its uses is very much important. So uses are, first one is used in malaria, as I told you, malaria. Then amoebic dysentery, amoebic dysentery, then rheumatoid arthritis, okay, lepra reaction, then discoid lupus erythematosus, discoid lupus erythematosus, photogenic reactions. Okay, let us discuss about another important drug, that is next important drug is quinine. It obtained from the cinchona alkaloid, cinchona alkaloid. Okay, it is the liver rotatory form. Okay, and its dextrorotatory form is used in arrhythmia, that is quinidine. Okay, so its action is, it is erythrocytic schizentrocyte. It is erythrocytic schizentrocyte. Okay, mechanism of action is similar to chloroquine. Is chloroquine, like it polymerizes, and it is polymerizes the hem, and that causes toxic reaction to the mm, protozoa. Okay, so then like chloroquine, it is also having other action, like it is having other action like local irritant and anesthetic property. It is also having. local irritant and anesthetic property. It is also increases the GI secretion. Okay. So let us discuss about its pharmacokinetics. It is completely absorbed orally with 70% plasma protein binding. Okay, 70% plasma protein bound. Okay, it is basically binds to which protein? Alpha 1 AGP acid glycoprotein. Okay, it binds to the protein alpha 1 AGP. Okay, it is metabolized by liver and T half. Its T half is around 10 to 12 hours. Okay, talking to its adverse effect, one of the major adverse effect associated with this is synchronism. Okay, when synchronism is basically dose related. Okay, it is seen if it is taken around 8 to 10 gram. If it taken 8 to 10 gram as a single dose, and it can causes even death. Okay, so synchronism is with if will take large single dose or higher therapeutic dose, it can produce synchronism. So synchronism is associated with symptoms like ringing of ears, okay, nausea and vomiting due to CTZ stimulation, nausea and vomiting due to CTZ stimulation, mental confusion, okay, vertigo, retinal, neurotoxicity. Such type of adverse effect are basically seen. Okay, so other adverse effect associated with this is like it show hypersensitivity reaction. Quinidine show hypersensitivity type of reaction. Okay, sometimes respiratory depression associated with synchronism, that is respiratory depression, pulmonary edema, cardiac arrhythmia, hypo cardiac arrhythmia. Such type of effects are produced. Okay, sometimes quinine can also causes hemolysis. Sometimes it can causes hemolysis, especially in case of pregnant women. Okay, in case of hemolysis seen in pregnancy, if we will give during pregnancy, it can causes. Okay, so its uses is quinine is basically use in drug resistance malaria. So if we'll talk about its uses, quinine is used in chloroquine resistance malaria. Okay, quinine can also used in cerebral malaria. Okay, this point you have to remember that sometimes it can also given during cerebral malaria. Chloroquine resistance malaria, it can also used in cerebral malaria. Okay, let us discuss about another drug, that is mefloquine. Okay, this drug is also used in chloroquine resistance plasmodium falciparum malaria. Okay, it is it is also used in chloroquine resistance plasmodium falciparum cases. Okay, so it is used also used in multi-drug resistance malaria. So one interaction one interaction drug interaction is seen is it causes QT prolongation. Okay, one drug interaction seen it is which causes QT prolongation if it will taken with quinine. QT prolongation, it show QT prolongation with quinine or haloperidol. Okay, this true drug can causes QT prolongation when it given with mefloquine. Okay, then let us talk about proguanil. Proguanil is a slow acting erythrocyte schizentocidal. Slow acting erythrocytic schizentocidal for plasmodium vivax and plasmodium falciparum. It is act as slow acting erythrocytic schizentocidal for plasmodium vivax and plasmodium falciparum. Okay, proguanil it converted to its active form or triazine derivative, that is cycloguanil. Cycloguanil by cyclization reaction. Okay, so this cycloguanil inhibit dihydro dihydrofolate reductase thiamidylate synthetase enzyme. Thiamidylate synthase enzyme in Plasmodium species. Okay. Okay, it is very well tolerated. Side effect is less as comparison to chloroquine, but having so some side effects like, okay, so side effect that produced by this drug is mild, like hematuria, rashes, stomatitis, etc. Okay, one important point is proguanil plus atobaquone. Atobaquone. This is used this is used as prophylaxis. This is used as prophylaxis while those who are visiting chloroquine resistance Plasmodium falciparum area. Okay, this proguanil plus atobaquone is a combined drug basically prescribed for the prophylaxis treatment of those person who are visiting chloroquine resistance Plasmodium falciparum area. There are several area like Karnataka, Odisha, such type of areas, and plasmodiums get plasmodiums are Plasmodium falciparum cases of malaria are resistant to chloroquine. So if those person are visiting such area, he or she has to take this proguanil plus atobaquone as a prophylactic manner. Let us discuss about primaquine. Okay, primaquine, it is an anti-malarial drug. Okay, with erythrocytic schizentrocidal activity. Okay, but it is more active against pre-erythrocytic stage. Pre-erythrocytic stages of Plasmodium falciparum. ये केस में more active है. Okay, it is absorbed by orally. Okay, THAP is around 6 to 8 hours. So it is used in Plasmodium vivax malaria and Plasmodium falciparum malaria. Used in Plasmodium vivax and Plasmodium falciparum cases. Okay, if we are talking about its dose, it is around 15 mg per day. Okay, 15 mg per day combined with clindamycin. Clindamycin 600 mg. Okay, then sulfolamide plus pyrimethamine combination are also used. sulfonamide plus pyrimethamine. Again sulfodoxime. Sulfonamide is specifically it will tell that is sulfodoxime. Okay, it will uh, it will precisely say sulfodoxime plus pyrimethamine combination that is available in market in the brand name of Fansidar. Dose is sulfonamide 25 mg, sorry, sulfodoxime so 25 mg, sorry, sulfonamide or sulfodoxime around 500 mg with pyrimethamine 25 mg dose. Okay, this combination is available in the market, that is sulfodoxime 500 mg with pyrimethamine 25 mg in the brand name of Fansidar. Okay, this combination is also available in the market. Then if we are talking about artemisinin derivative, okay, this drug it is obtained from a plant, that is Artemisia annua. Artemisia annua, also known as queen ghosu. It is a Chinese plant. It is a sesquiterpene lactose endoperoxide. It is a sesquiterpene lactone endoperoxide linkage. These drugs having sesquiterpene lactone endoperoxide linkage, which is effective in case of plasmodium falciparum resistance cases. Effective against plasmodium falciparum cases. Okay, it is a potent and rapid blood cytotoxicidal. Potent and rapid. It is a potent and rapid blood cytotoxicidal. Okay, so drugs are artemether, artesunate, artemisinin. तो ड्रग का एग्जाम्पल क्या क्या है? आर्टिमीथर, आर्टिसुनेट, artemisinin. Okay, artemether is oil soluble. It is oil soluble type of. Okay, artesunate is water soluble. Okay, these are the artemisinin derivatives. So its mechanism of action is its mechanism of action. So how it is mechanism of action? It's endoperoxide linkage. The endoperoxide linkage present in artemisinin derivatives complex with form a complex with hem. ये क्या करेगा? हेम के साथ एक कॉम्प्लेक्स फॉर्म करेगा. ठीक है, this formed complex form a highly reactive form, highly reactive free radicals. Okay, these highly reactive free radical lipid peroxidation, causes lipid peroxidation and endoplasmic reticulum damage to the parasite. Endoplasmic reticulum damage ऑफ पैरासाइट, पैरासाइट का ये लिपिड पेरोक्सीडेशन करेगा एंड एंडोप्लाज्मिक रेटिकुलम का डैमेज करेगा. ठीक है. So its adverse effect is quite severe that it can causes different type of arrhythmia like arrhythmia by causing QT prolongation. Okay, it causes QT prolongation, change in ST segment, ST segment change. It also causes AV block. All these type of arrhythmia can caused by this artemisinin derivative after. Okay. Sorry. So due to this property, so drugs like quinidine, quinidine class of drugs are not prescribed, not combined with this class of drug because severe arrhythmia can produce. Okay. Okay. Thank you.